So, friends, today we will talk about the topic called eye. So, basically, eye is belong to sense organ. Basically, whatever the wonderful nature we are seeing with the help of eyes only. So, the small injury to our eyes will decrease the whatever vision we are seeing. Okay, so it's a God gift to us, very wonderful gift. Without the eyes, we cannot see, we cannot imagine the world. So if you want to buy any camera which have true vision, okay, which have high sensitivity of megapixel, so basically it will cost lakhs of rupees. Okay, even some cameras have cost millions or billions. Okay, so but without any cost, our God gifted us with very wonderful eyes. Okay, with the help of eyes, we are able to see the whole world. So let's see how the eyes work, how the vision will reflect into our brain, what are the pathways, and what are the patho internal physiology of the eye. We will discuss all those things in details. Okay, so the eye. The eye contains the receptors for vision and a refracting system that focus light rays on the receptors in the retina. We will begin our discussion, however, with the accessory structures of the eye, then later return to the eye itself and the physiology of the vision. So basically, so how the light rays enter into our retina. So how with the help of receptors. So we have vision receptors. What we have? We have vision receptors. Okay, vision receptors for vision. With the help of this receptor, the receptors will catch up the light rays, and with the help of retina, it will travel to our brain, visual area. Okay, so first here we will discuss with structures. What are the structures? What are the physiological structures are present, anatomical structures are present in and around eyes. First we will discuss, then we will talk about eye itself. Okay. Next, first we have eyelids. So these are the eyelids, and after that we will have lacrimal gland. Okay. So why we have eyelids, then why we have lacrimal, then we will talk. The eyelid contains skeletal muscle that enables the eyelids to close and cover the front of the eyeball. Eyelashes along the border of each eyelid help keep dust out of the eyes. The eyes are lined with a thin membrane called conjunctiva, which is also folded over the white of the eye and merges with the corneal epithelium. Inflammation of this member called conjunctivitis may be caused by allergies or by certain bacteria or viruses and makes the eyes red, itchy and watery. So basically eyelid. So basically this is the eye. So above the eye we have the eyelid. Okay. Eyelid have eyebrows, and as well as these are the we have these are the hair. So why we have this hair and why we have eyelid? It's to protect the eyes from outer environment which is harming the eyes. So whatever substances harm our eyes, it will protect, like dust. Okay, dust. So dust is very harmful to our eyes. And another thing, air, it will also protect from the air, and whatever the outer environmental harmful substances or organisms, like any small bee, okay, any small microorganism which is want to enter into our eyes, it will protect. When you close the eyelids, it cannot able to enter into our eyes. So there's the protection. Okay, like our house have doors, our shops have shutters, okay, and grills. So like our eyes have protection, that is eyelid. The eyelids are lined with thin membrane called conjunctiva. So, so this is the covering. So eyelids. When you see the eyelids, we have this is the one of the lines. Okay, this is if this is eye, this is the covering. This is the lining. This lining is known as conjunctiva. So we'll see in detail here. The image is not available. So we can see that this is the conjunctiva. So this is the cornea. Okay, and first layer is mucus layer, second is water layer, third layer or oil layer in cornea. You can see that's conjunctiva. This is also conjunctiva. This is also conjunctiva. This is also conjunctiva. Conjunctiva fornix. This is and this is the bulbar conjunctiva. Above this palpebra conjunctiva. So let's see this in this image. Okay, this is the you can see that this is the eyelid. Okay, this is the eyelid. Basically, this is the eyelid. Okay, this is the eyelid. So if you turn the eyelid, so this is the conjunctiva. If you turn the eyelid, this is the conjunctiva. You turn the here is also conjunctiva. So bulbar conjunctiva, palpebra conjunctiva, fornix conjunctiva. So basically, this is very helpful for our eyes. So if you get any bacterial infection, any infection which affect conjunctiva, so though your eyes become pink or reddish, and some substances will release from the eyes. Okay. So conjunctiva, which is also folded out the white of the layer and merges with the corneal epithelium. Inflammation of this member called conjunctivitis. So what is the disease name? We call conjunctivitis. Inflammation of the conjunctiva. Okay. Why this happen? Because of the allergies, dust, any bacteria, any virus. So what will happen? Our eyes become pinkish, reddish, or itchy and watery. Next, so we have whenever any dust enter into our eyes, whenever we rub the eyes, so what will happen? We have tears. Okay. So whenever we cry, what will happen? We have tears. So from where the tears are coming? So the tears are coming from lacrimal gland. We have one gland, okay, upper area of the eyeball. This is the lacrimal gland. So why this is? Because of to wash the eye. So this is the lacrimal gland and lacrimal sac. From this area, the water will come and will release from this area. Lacrimal canals, lacrimal sac, and this is naso lacrimal duct, nasal cavity. So this is the nasal cavity. Nasal cavity. This is okay. It is attached to the lacrimal glands. So basically, whenever we have cold, whenever we have allergies, whenever you have cough, whenever you have sneezing. So what will happen when you sneeze, when you cough? So it is also attached to the nasal area. So you something may be affect to the eyes also. You may have tears from the eye. Maybe you have redness in your eyes. Okay. So this is all about lacrimal gland. I advise you please draw the diagram. For detail, you have to observe those things, the area. Okay. Secretion of tears occur constantly but is increased by the presence of irritating chemicals. Onion vapor, for example, dust. In certain emotional situation, sad or happy, small ducts take tears to the anterior of the eyeball, and blinking spreads the tears and washes the surface of the eye. Tears are mostly water with about 1% sodium chloride. Similar to other body fluids, tears also contains lysozyme, an enzyme that inhibits the growth of most bacteria on wet, warm surface of the eye. At the middle corner of the eyelids are two small openings into the superior and inferior lacrimal canals. These ducts take tears to the lacrimal sac, which leads to the nasolacrimal duct, which empties tears into the nasal cavity. This is why crying often makes the nose run. Okay, so already I explained, but one thing is in the tears we have 1%, 99% is water, and 1% is sodium chloride. 1% is sodium chloride, and also tears have lysozymes, which inhibits the growth of bacteria. सो यहाँ पर बताया जा रहा है आपको, हम लोग बात कर रहे हैं आइस के बारे में. सो बेसिकली आइस, पहले हम ऊपर से अंदर की तरफ आएंगे. सो आईलिड्स है, हमारे जो आईलिड्स है वो प्रोटेक्शन के लिए है, ताकि आपके अंदर कोई भी चीज आंख के अंदर ना आ सके, क्योंकि आई सेंसिटिव है. ठीक है, इसका अगर डैमेज होगा तो बॉडी के लिए बहुत ज्यादा नुकसान है. तो पूरी जिंदगी इसको सेफली आपको रखना है. तो इसके लिए गॉड ने गिफ्ट दिया, क्या दिया, आइस के साथ उसके प्रोटेक्शन, आईलिड्स. एंड थोड़ा अंदर जाएंगे तो कंजक्टिवा, कंजक्टिवा है. कंजक्टिवा ऊपर का, नीचे का, बीच का, तीनों का है अलग अलग. ठीक है, यहाँ पे आप इमेज में भी देख सकते हैं, ये आप कंजक्टिवा यहाँ पे भी है, पल्पब्रार, फैब्रार. ठीक है, ये सब चीजें तीन टाइप्स के हैं. फिर उसके बाद लैक्रिमल ग्लैंड, ये लैक्रिमल ग्लैंड, यहाँ से इसका एम्प्टी स्पाइस का कनेक्शन यहाँ पे है, डक्ट. लैक्रिमल सैक है, लैक्रिमल कैनाल्स है, नासो लैक्रिमल डक्ट है. तो यहाँ से आके यहाँ पे रिलीज हो जाता है. तो ये क्या करता है, वॉश करता है जब भी डस्ट आया. ठीक है, जब भी आपको और छींके बार बार आती है, ठीक है, और कोई बैक्टीरिया आ जाता है, तो जो भी चीजें आती है उसको वॉश करने के लिए है. तो इसके अंदर साथों साथ 1% सोडियम क्लोराइड भी. ठीक है, और साथों साथ इसमें लाइसोसोम्स भी है, ताकि बैक्टीरिया के ग्रोथ को रोक सके. ओके, so this is eyelids and lacrimal apparatus. Next we have eyeball. So this is the white color, this is the ball is known as eyeball. Most of the eyeball is within and protected by the orbit formed by the lacrimal, maxilla, zygomatic, frontal, sphenoid, and ethmoid bones. The six extrinsic muscles are attached to this bone socket to the surface of the eyeball. There are four rectus. So basically, so this is the eyeball. You can see this is the eyeball. In the above we have conjunctiva and cornea, okay, retina, everything is there. And eyeball is attached by the muscles. So this is the muscle, this is the muscle, this is the muscle, this is the muscle. Four muscles are there. And as well as we have the covering of bones. In between bones, we have eyeball. So ethmoid bone is there. Let's see the eye orbit, eyeball orbit. Hmm. So this is the eyeball orbit. So basically, this is the orbit, and we have number of bones are joining here. You can see this. This is the frontal bone. This is the frontal bone, and this is the zygomatic bone. This is the maxilla, palatine bone, lacrimal bone, ethmoid bone. So you have number of bones here, which makes orbit. So in this orbit, the eyeball is situated, and it have protection by the bones and the muscles. Okay, these are the things you have to understood. Okay, and we have muscles also, six intrinsic muscles. Okay, now what are the muscles we will talk about? There are four rectus muscles that move the eyeball up and down or side to side. So basically, we have protection for we have extrinsic muscles and bone, but for the movement we have four muscles. How many muscles? Four muscles. So what are those muscles? To move up and down and side by side. Okay, one is medial rectus muscle. Okay, and the second one is oblique muscle. Next is so basically what the medial rectus muscle do, pulls the eyeball medially as if it to look at the eye nose. So basically, if you want to see the nose, so with this help of the medial, so basically medial means middle. So middle muscle. So bring the mid muscle, bring the eyes to the middle center center. So with the help of this muscle, we can see middle center, whatever center things are there. Next we have second is two oblique muscles. So basically two oblique muscles. So we have three number two oblique and one medial rectus. Three. Rotate the eye. So it will rotate the eye. If you want to rotate the eye, you are moving your oblique muscles. Okay. The cranial nerve that innervate these muscles are the oculomotor, trochlear, and abducens. We know that. So which move these muscles with the help of nerves. So I have cranial nerve now number 3, 4, and 6. Okay, the very rapid and complex coordination of these muscles in both eyes is fortunate, not something we have to think about. The convergence of both eyes on an object is very important to ensure a single image. That is to prevent double vision and to give us depth perception and three-dimensional world. So basically, whenever you see, so both eyes we have to move very rapidly, very fast. So with the help of this muscles only, we are going to move the muscles. Okay, with the help of nerves. So we can see we can rapidly move our eyeballs. Okay, one thing. Second thing is that if we if one eye is moving and second is coming with 1 2 second late, what will happen? We have double vision. Okay, we have double vision. So you can see that the muscles of the eyeballs here we have one is superior palpebrae superior muscle. This is superior rectus muscle, laterus rectus muscle, inferior rectus muscles, inferior oblique muscles. So these are the muscles which are connected to the eyeballs. Next, we will how to talk about layers of the eyeballs. How many layers are there? Okay, let's talk about eyeball now. So we talked about eyelid, we talked about conjunctiva, we talked about lacrimal glands, we talked about the muscles of the eyeballs and the bones of the eyeballs, the orbit of the eyeballs. Now we will talk about layers of the eyeball. How many layers are there? What are present in the eyeball? Okay. In its wall, the eyeball has three layers. So how many layers? One, two, three. The outer is sclera, middle choroid layer, and inner retina. So we have sclera, choroid, and retina. Sclera, choroid, retina. Sclera, choroid, and retina. The sclera is the thickest layer and made up of fibrous connective tissue that is visible as white of the eye, the most anterior portion of the cornea, which differs from the rest of the sclera in that it is transparent. The cornea has no capillaries, covers the iris and pupil inside the eye, and is the first part of the eye that refracts or bends light rays. So basically, you have eyeball. Eyeball is first layer is sclera. So whatever whitish color you are seeing, that is sclera. In that we have the layer, the anterior portion of the sclera is covered with one layer that is called cornea. So basically cornea is the first part when the eye rays enter, light rays enter. So what the iris bent with the help of cornea. So let's see with this image. So basically this is imagine this is the white ball. This is You have sclera here, sclera eyeball. This is a sclera. Okay. Okay. We will see in detail sclera. Then after cornea. Three layers of. This is, you can see that. No. This is the sclera. So basically, you can see that this is the bluish color is sclera. So this is already covering whole from here to here. This is the sclera. Next is choroid. The light pink color is choroid, and this is your retina. Retina also covering. Okay. For the this sclera, we have one first layer. You have cornea. You can see that this is the cornea. So this is the pupil, and this is the iris. So the first when light enters, it touch cornea. What how for where it touch? It touch to the cornea. Then enter we have iris. Then pupil. Okay, then we have retina. Everything is that we will see in detail. So first you understood cornea, sclera, choroid, and retina. Okay, next. Okay, understood. Next, but basically you have to understood that the cornea doesn't have a capillaries. So it will get when your eyelid opens and close, it will get oxygen with the help of eyelid. Okay, and with the help of the sclera, whatever oxygen and blood get to the core sclera, it will also reach to the cornea. Okay, this thing you have to understand. The choroid layer, second layer is choroid layer, contains blood vessels and dark blue pigment derived from the melanin that absorbs light within the eyeball and thereby prevents glare. The anterior portion of the choroid is modified into more specialized structures, the ciliary body and the iris. Okay, so you have to see that image. Okay, basically this is the choroid. So this is the choroid, this is the choroid, this is the choroid. Okay, but it have very deep structures here. Here we have the ciliary body, and you have the pupil and lens. Okay, and here we have suspensory. So these are the things which are available in the choroid. Okay, choroid has ciliary body. So ciliary is no, nothing but muscle. Is a circular muscle, and as well as you have to observe that whatever blood vessels are present in the eyes are present in choroid. Okay, these are the things also you have to remember. You can see that. So capillaries are present in choroid. Okay. So we have ciliary body is a circular muscle that surround the edge of the lens and connected to the lens by suspensory ligaments. Okay, suspensory ligament. The lens is made of a transparent elastic protein and like the cornea has no capillary. So basically first you have to talk about ciliary body. Ciliary body is a circular muscles that surround the head of the lens and is connected to the lens by suspensory ligaments. So you can see that in this image. So basically this is the ciliary body and is connected to the lens. So it is holding the lens with ligaments. This is the ciliary body. This is the ligaments. So it is attached to the lens. Okay. And holding the lens. Holding the lens by standing. The lens are standing on the ciliary body and the suspensory ligament. Okay. Understood. Next we have lens. What is the lens? Lens is also made up of elastic protein. So it's made up of protein and the cornea, like cornea, has no capillaries. So basically, Lens doesn't have capillaries. Okay, so in cataracts, what the surgery is done, the lens is changing. They will change the lens. The shape of the lens is changed by the ciliary muscles, which enables the eye to focus light from the objects but varying distance from the eye, which enables the eye to focus light from objects at varying distance from the eye. So basically, the lens is changed. The shape of the lens will change. It will decrease the lens size, shape. It will sometimes it will increase the shape. So while depending upon the light rays, whatever light rays are coming. Okay. Next is just in front of lens. So who will decrease the shape and or constrict or dilate? It is iris. Just in front of the lens is circular is iris, the colored part of the eye. Its pigment is a form of melanin, what we call eye color. So basically the color is blue, the eye is bluish, the eye is reddish, the eye is brownish, the eye is blackish. So how can we are knowing with the help of this iris? Okay, the color of the eyes depend upon iris and is genetic characteristic just as skin color is two sets of smooth muscle fibers in the iris change the diameter of the pupil. The central opening, contracting of the radial fibers dilate the pupil and is a sympathetic response. Contraction of the circular fibers constrict the pupil, that is parasympathetic response. Pupillary constriction is the reflex that protects the retina from intense light or that permits more acute near vision as when reading. Basically, we know that this is the iris. This is the iris part. So behind uh, backside of the cornea, we have iris. So iris is colored. So depending upon the iris, we will tell that the eyes are bluish color, the eyes are black in color, the eyes are very like cattish eyes. Okay. So likewise, skin color, we have different types of iris color. So basically, it is very helpful in electrohomeopathy to diagnose the temperament or constitution. Okay, because it is also genetic. Okay, so in the iridiology, we see the iris of the patient. Okay, and you have pupil here and the lens. So depending upon the condition of the right rays, the pupil constrict and dilate. So these are the parasympathetic and sympathetic pathways we already studied in cranial nerves. Okay, where you can review there. Next, we have retina. Okay, so basically the retina is very in detail. Okay, we will continue tomorrow about the retina. Next, we have the one box that is cataract. We will complete this cataract. The lens of, because it is connected to the lens. The lens of the eye is normally transparent but may become opaque. The cloudiness or opacity is a cataract. Cataract formation is most common among elderly people with age. The proteins of the lens break down and lose their transparency. Long-term exposure to ultraviolet rays seem to be contributing factor as is smoke. The cloudy lens does not refract light properly and blurred vision throughout the visual field is the result. Small cataracts may be destroyed by laser surgery. Artificial lenses are available and may be surgically implanted to replace an extensive cloud lens. The artificial lens is not adjustable. However, and the person may require glasses or contact lens for vision at certain distance. So basically, the cataracts, we know the cataracts that this lenses made up of proteins. So according to the elderly, the person will reach to certain age, the proteins will break down. What will happen? Whatever the lens is made up of proteins, so the proteins that breakdown happen. So the person's vision will decrease. And the second most common thing that will damage the protein, that is smoking. Okay, so the light could not enter into the eyes because the lens are completely, the proteins are damaged. So what will we do? Sometimes they will remove the if there is small type of protein loss is there, so with the help of laser we will break the proteins. Laser surgery will destroy. Okay, and or we will remove and put the artificial lens. But one thing is that the lens will cannot be adjust the light rays. So we need contact lenses or specs to adjust the light rays. Okay, so very crucial thing that lenses are. Okay, so we have to protect our lens, we have to decrease our bad habits, we have to drink lot of water. Okay, and we have to stop smoking and advise the patients to stop smoking because it will damage your lens. Okay, so because in the elderly person they will get those things today, these are the common things. Okay, so we have to counsel the patient about these things. Okay, I hope you understood the class. If any doubts, you can ask.